Good evening. I'm Dan Lothian of WGBH. Thanks for joining us tonight on the state of race COVID-19. For a while, we weren't aware of how dire the numbers were, but now we know just how bad they really are. According to the City of Boston's own website, we know that Black African American people make up 37% of known COVID-19 cases in Boston. What's more, Black African American people make up 35% of known COVID-19 deaths in Boston. And that's as Blacks and African Americans make up only 25.3% of the Boston population. So the big question is why and what can be done about all of this? The challenges of growing up Black and brown in Boston have always been daunting. Now, due to COVID-19, the profound inequities of health, income, housing, and education are even more stark. For the next hour, I'll be talking with a group of panelists about the causes of racial disparities, and hopefully we want to take a look at some of the solutions. No conversation is complete if we're just talking about the problem and not focusing on what can be done on the future here in the Boston community. We'll also be taking your questions. But first, my interview with former City Councilor Tito Jackson, who contracted the virus at the onset of the pandemic back in the spring.
And at that time in March, we did not know it was going to disproportionately affect Black folk as much as it did. But there were rumors in the community that Black people didn't get corona. The first cases that we heard were, kind of Tom Hanks and his wife and the Biogen stuff. And then, there were many conversations and some heated that I got into with friends that, hey, this is something that's not, that won't miss us as a people and as a community.
Well, take us back now to, I guess it was in mid-March when you started experiencing some of the symptoms.
I was kind of drenched in sweat. I had a fever and then began with a headache. And then within a couple of days, I began to feel, labored breathing as well as stabbing, like it's like someone took a needle and was stabbing it in my ankle joints and my knee joints. It doesn't stop on a dime. And so, the lethargy, just the issues around energy. I then began to have some weird things happen with the bottom number in my blood pressure, which is now back under control. And by the way, you're in the media. The wall-to-wall coverage of this while you're trapped in your room is a little tough because you literally are thinking about your mortality, whether or not you're going to live or die.
And even as that's going on, you're also watching, close friends succumb to this in the most serious of ways.
You actually have, people who you know and love who end up passing from this, which is just hard. A friend of mine and 25-year-old guy, he ended up breaking a leg, went into the hospital and contracted COVID and ended up passing. When you have COVID-19, you realize that your health and well-being is a privilege. And from an inequity perspective, hey, we got to question our medical system, whether or not things are all right. We have to question whether or not we're able to take care of our elders. And, now we're at the juncture of what do we do with our children? And also, do we have the financial resources to take care of everyone? So there's a lot to think of in addition to myself.
Well, it was an honest and powerful conversation with him. And one of the things he also told me that his connections in government really helped him to be able to get tested. If you recall, early in this pandemic, it was difficult for anybody to go and get tested. There was this priority list. And so his connections did help him get in much more quickly than other folks. And he also said that he had a doctor who walked him through all of this and helped him and continues to help him with his recovery. And again, this is something that, a lot of people, especially those in poor communities, don't have that connection with a doctor. They haven't been in to even get checked up, get these checkups in quite some time. And so the problems that folks like Tito have are more easily attacked than those who don't have the connections and don't have that connection even with their medical personnel. Just a real moment in that conversation. The reason he's talking out is to really educate the Black and Brown community in Boston. Well, let's meet some of those who are joining us on the panel this evening. Tanisha Sullivan is president of the NAACP Boston branch. Dr. Thea James is the Associate Chief Medical Officer and Vice President of Mission at Boston Medical Center. And of course, Adrian Walker is the Metro columnist for the Boston Globe. And of course, all of you out there who are watching, we so much appreciate you coming along for this show. And we're looking forward to hearing and answering some of your questions. If you're joining us on Zoom, send us your questions in the Q&A tab at the bottom of your screen. If you see a question that you want an answer to, you can just vote by clicking on the thumbs up. If you're watching on Facebook or YouTube, you can leave your question in the comments section. And then don't forget to let us know where you're watching from. That's always great information to have as we continue to do more of these kinds of shows. So let's drill down on just the overall impact on the Black community in Boston. Dr. James, you're on the front lines at Boston Medical Center. And before we had any of the data, you must have suspected that there was this disproportionate effect of COVID-19 on the Black and Brown community. No doubt, right?
Absolutely. As you said, no doubt. I mean, as you know, Boston Medical Center is a safety net healthcare system. And what COVID laid bare for the country is laid bare here 24/7 for decades. And in fact, we could have predicted the outcomes and the data that we saw in terms of how it impacted communities of color across the country. We are familiar with, and we really sort of understand the root causes of that type of data and the impact it had, because we engage with our patients to understand why they come in the hospital repeatedly, why they get admitted multiple times in a year, why they show up in the emergency department multiple times, over and over, same people for the same reasons. And what we've come to know because it begs the question, what would it take for this not to happen again? And it's a question that we ask patients, and at least I do, and the patients will tell you, and what we have learned from that is that they really cannot prioritize health, because they're basically trying to survive. And so they are in this space and not able to prioritize health because they are coming from communities that have been disinvested in, which created these structural barriers, and structural racism, essentially, that has prevented them from being able to achieve the sorts of things that enable people to thrive, and certainly to weather something like COVID. And I'm talking about things like financial stability, opportunities to create those kinds of things for yourself and for your community, financial stability, economic mobility, and opportunities to build wealth. All of these things sort of are protective factors for you when you are stressed by a certain type of a crisis. And so those types of inequities that it leads to impact health. And when our patients come here, we basically treat them for certain. But what we're really doing is resetting them back to baseline, and then you wind up discharging them back to exactly what's driving it. And so I hope this has been a bit of I know it's an awakening, but it's certainly maybe a reckoning to understand what we need to do, because we don't need to invest more in trying to do something different in the same way. We need to address the root causes. We need to disrupt it and make it so that people can be independent, self-sufficient, and able to prioritize their health.
And Adrian, I want to go to you, because this kind of dovetails with something that you've said in terms of the conditions that cause what we're seeing now are not unique to COVID-19, but part of society in general. What were you trying to say by that?
I mean, as Dr. James said, there's nothing physiological about this, okay? What's driving this are all the inequities we see every day in the lives that people lead every day. And if anything good comes out of this, which remains to be seen, I hope it will be that we will begin to come to terms with the structural issues that lead to this kind of tragedy, because it's so preventable.
I'm wondering, Tanisha, why do you think? I guess many of us are just sort of waking up and saying, "Oh wow, this really is bad." Why did it take so long for many people to realize that this was happening? Is it because we were just all dealing with this mysterious illness, something we hadn't, seen in the past, and we were just scared and focused on survival and not really looking at some of the people who were really being hammered by it?
Well, I think there are a few things at play. Certainly, as Dr. James noted, the COVID-19 pandemic, public health pandemic, really highlighted the real deep health disparities that have existed for quite some time. This pandemic also exposed the very deep economic inequality that exists even here in the Commonwealth. And both of those aspects of the COVID-19 pandemic have been, from a data standpoint, we've seen the data points. We've seen industry reported in the media. What we haven't seen as much of are the other issues and disparities that this pandemic has exposed. Adrian alluded to them when we think about education, when we think about the impact of this virus on our young people, and how, quite frankly, we're looking at a situation where, children left in March, and who knows when they will go back in. And yet we're still having conversations about how do we fit old education models into this COVID-19 reality, what our conversations really should be about is how do we reimagine education similarly to how we are now in the process of rethinking and reimagining what policing looks like. It's also exposed, of course, as it relates to housing. And we cannot forget that while much conversation has been around our urban cores, this virus also hit 351 cities and towns across the Commonwealth. And one of the consistent threads has to do with poverty. And we really have to get to the point, if we're going to have a meaningful conversation about race, we also have to be willing to have a deep, intentional conversation about poverty, even in the Commonwealth.
Well, look,
Dr. James, I want to go back. Oh, go ahead.
The city that's been hit hardest in Massachusetts is Chelsea, right? Let's look at it and think about why. You think about who lives there. You think about the income level. You think about a city full of people who can't work from home. You think about people who've had to go to work during this pandemic. It's been a petri dish of inequality. And it's a perfect example of all the things this is exposed.
Absolutely.
But why is that happening? That's an important point. But why is that happening? And Mr. Parsons from Manchester, New Hampshire, asked this question, saying, why we live in this progressive state. Why is this happening here? I mean, it's probably progressive. Maybe this should be happening somewhere else, but not here. Why here?
Well, I would respond to that quite simply, that even for progressive, liberal Massachusetts, we have yet to really wrestle with our own history and current existence with racism. We have certainly all of the resources, one would think, all of the resources to have avoided the outcomes that we're seeing as it relates to the COVID-19 pandemic. But the reality is that we still have structural racism to wrestle with here in the Commonwealth.
We also have to live in a state. Oh, sorry, Adrian. Sorry about that.
No, go
ahead. We also live in a.
James.
Thank you. I'm sorry. We also live in a state that has quote unquote universal health care or health insurance. Over 90% of the residents of the Commonwealth have health insurance, and it's not exactly having the impact we would hope it would have. because it's there, but people can't exactly prioritize it, because they're so busy trying to use what, limited resources they have to, for housing or food insecurity or transportation or whatever. They can't think about using it for prescriptions and co-pays for healthcare and things like that. That's definitely, not going to be a priority for them. So, I agree with both what Adrian and Tanisha said, and I think it's like if we can put these things together. I mean, I think we do have resources, but we have to put these things together, understand the intersections, about how structural racism impacts all of these various different things, despite having all these resources and not changing the outcomes. That's the level of intentionality that we're going to have to put to trying to change things.
Dr. James, before we move on to another subject here, I do want to bring up one question from an audience member having to do with the medical community. This person said, what would the panel suggest doing about policies that a hospital's trustees create without any racist intent, but which predominantly adversely affect people of color, and how does that intersect with class?
I mean, I think, first of all, it has to be a realization. It has to be a reckoning. It also might help to, with who you have on the board, how awake and, aware people are who you have as members on the board. But there has to be, you said that they may not do it intentionally, but there has to be some mechanism of recognizing it there. So that has to be the case. Somehow you have to do that. You have to be intentional about and look for that kind of stuff, those kind of things.
I want to weigh in on that as
Tanisha,
well.
We're talking a lot about anti-racism.
Oh, sorry.
Tanisha, go ahead, Tanisha.
We have to get to the point where we push past this idea that if you're a good person with good intentions, that the outcome doesn't matter. And in this moment, right now, when we have seen across the Commonwealth people from, again, every background saying, oh my goodness, I did not realize that this is what racism looks like. People across the Commonwealth are saying, Black Lives Matter. The next step to that, the next step beyond simply protesting in the street or saying Black Lives Matter is to understand that if your actions, if your policies are having an adverse impact on people of color, on Black and Latinx people, and that's not your intention, then you need to be willing to disrupt that policy. You need to be willing to change that policy. It can no longer be, it's not our intention to cause harm. In this moment, we have to be intentional about focusing also on the impact.
And I think you'll hear that more and more now as this conversation continues, right? It is out there in the public, everyone's talking about it, so perhaps that's what will cause those in the medical community or others who've been hiding behind the intentional excuse to really start looking inward, right, and then making those changes. I want to move, if we can pivot, just the issues of COVID and housing. Olivia Amadon is a social worker at the Dimmick Center in Roxbury, and her clients are primarily Black and brown. Many of them are frontline workers, they're cleaners, service people, et cetera. And she's really worried about this issue of isolation and the mental health of some of her clients. There's also the health barriers, right? Or rather the language barriers that they face in getting information, not just any information, but good information. And of course, there's their living situation.
One of the biggest things that I see having an impact is housing and the lack of affordable housing. My clients who are on wait lists for affordable housing are going to be on those wait lists. They've been on them already for 5 years, and they're going to be on them for probably another 5 or 10 or 15 or who knows. And that has an impact on their health, right? It has an impact on the fact that they have to make a choice between paying a rent that's 75% of their income, or staying home with their kids and making sure that their kids are safe.
Tanisha, if you want to jump in on this, how big of an issue is this, where the housing issues that some people are facing further puts them behind, puts them in a hole?
Absolutely. I mean, housing is one of our greatest challenges here in the Commonwealth. That was even before the COVID-19 pandemic. We really do have to become, I think, even more progressive in our housing policies. The fact that that we have cities where the wait list for affordable housing is years long is just completely unacceptable when we have towns and other cities surrounding the urban core that have plenty of space. And so what that means, Dan, is that again, here we are in this moment where, folks are saying that they now see that there's racial injustice and they want to know what they can do. I would submit that, in cities and towns across the Commonwealth, we should be having meaningful, deep conversations about our zoning laws, for example. We should be having conversations in cities and towns across the Commonwealth asking, look, if you live in a town that does not have affordable housing, and I'm not talking about, 3 units, if you're living in a town or a city that doesn't have affordable housing that is, safe and accessible, the question needs to be why. And we need to really have, again, honest conversation about why it is that so many cities and towns have resisted really doing their fair share to make sure that all of our Massachusetts residents have access to safe, affordable, environmentally safe and affordable housing. And that's something that each of us can be doing.
And I know, there's been the fear in many communities, inner city communities, about evictions, right? And, are they going to be thrown out because the jobs, the low-paying jobs that they did have went away and they can't afford to pay their rent? And I guess a little bit of yesterday, Governor Baker, just extended the moratorium on evictions in Massachusetts until October 17th. So that's good for all residents of the state, but certainly for those people of color. I want to bring in some questions from our audience members. David from Boston asks, I am most concerned with nursing home workers of color who do not have access to adequate housing, medical care, or transportation, who often are forced to work at several facilities in order to survive. What steps can be taken to ensure the safety of these workers and thereby the inhabitants of these facilities? Dr. James, you want to take that one?
Well, I think it would be helpful if we had some standards. I don't believe that there are standards across the various different nursing homes in terms of what kind of safety measures are in place in terms of like PPE and that type thing. I've talked to different people, who have had some insight into that. And from what they tell me, there are no standards across the Commonwealth for those places. And so I think we could start there, because the 60% of the of the COVID deaths that happened were in nursing homes. And I think that's a major problem. So that's something that we definitely could address. I don't think it's that difficult, to create standards. Like we have standards in hospitals and community health centers. I don't understand why we can't also have them in nursing homes.
Adrian, Paula from Hull, Massachusetts, asking, how can our predominantly white communities make the necessary changes towards combating segregation in education and housing, given the embedded structures currently operating that created these circumstances?
It's not all about embedded structures. I mean, there are state laws about affordable housing that have never been followed or enforced, and that suburban communities have found a way to get out of for 50 years. I mean, this isn't necessarily about dismantling an entire economic system. It's about passing some laws and forcing suburban communities that have resisted to follow those laws. And I think that's an eminently achievable goal.
And then one more question from our audience. Malika from Hyde Park is asking, are there any special resources set aside for Black people in the city of Boston to be able to purchase homes to stay in the city? Anyone want to take a stab at that one?
Sure. So prior to COVID-19 and even through the COVID-19 pandemic, there are affordable housing, home ownership programs that are offered both by the city and also through mass housing. So at the state level as well, that provides support to individuals who want to be able to own a home. That's actually one of the things that I think we need to talk more about. When we talk about affordable housing, I think it's important for us to make sure that the conversation is not just about rental units, but that it really is about home ownership as well. We have to remember that from a historical perspective, one of the ways that really a cornerstone within our country to build wealth is through home ownership. Of course, the Globe Spotlight series highlighted this back in 2017. And also, the Color of Wealth study also shows, the net worth of a wealth of a white family in the city of Boston, $247,500. That of a Black family is $8. A lot of that is in home ownership. So we really want to get to the point where we start to dismantle, disrupt, and or have the power to really help enforce some of these laws that are on the books. We really have to work on the building of wealth and programs that support affordable home ownership, I believe, is key.
I think there's another
When you say
paradigm.
I'll come back to you in just a moment there, but when you talk about have the power, what did you mean by that? Like, how do you get the power for something like that?
Yeah, so we do need to have a conversation about power. And Adrian just lit up because this is his thing, We do need to have a conversation about power. I mean, what you heard even in Council Jackson's story, his story about his experience with COVID-19. We've seen it in other situations as well. Those who have access to political structures, those who have access to financial structures of power, here in the city, across the Commonwealth, across the country, are oftentimes able to move systems, to move policy, to move legislation in a way that others are not. And so part of the work that we have to do in this moment, and certainly 2020 is showing us this, is that we need to have real conversations about power, what it looks like, who has it, how it is taken, and being very clear that a key lever in that is voting rights and access. 2020 is going to be a big year. And as we're having conversations about racial justice and racial equity, voting is absolutely a key component of that. Who we're electing at the municipal level, at the state level, at the federal level matters. They're the ones who made decisions about who got testing and who didn't get testing. They're the ones who make decisions about whether certain policies or legislation or laws are going to be enforced and how. So voting is absolutely a critical part of this conversation.
Adrian, since Tanisha said that you just lit up, go ahead.
When we talk about voting, and you're completely right about this, we focus so much in years like this on the presidential election, right? But it's also important who we're electing to local office and who we're putting in the state house, because that's where a lot of this is happening. Those are places where our communities should have a lot more power.
Okay, let's turn back to the issue of health circumstances for Black communities. I talked recently with State Representative Liz Miranda, and she was severely impacted by COVID-19. Not only her, but a large portion of her family. Take a listen.
I have been working so hard that in the last 3 months, I haven't really taken stock of the way that COVID ravaged my family. I was sick for a week. I could not get up for 4 days. My grandmother has been in my care, my family's care, for 10 years. And the fact that I lost her on April 17th, a week before we all found out we were sick, and she had gotten 2 negative reports of COVID. And so we felt like we were safe. My family is still very fearful of COVID. My community is still disproportionately impacted. Black and brown people are dying at a rate of 42% in comparison to other members of Boston.
What do you think is the main issue, the main reason behind this problem?
It say it's structural racism and the poverty crew. I can't begin to tell you that the lack of access to care, the response out of the White House was woefully insignificant and actually, I would say, quite criminal. Testing in our community came late. There's an issue around language access. Folks did not receive the materials that they need in the language, their first languages. My district, the Fifth Suffolk, beloved Fifth Suffolk district, is 52% foreign born. People speak Vietnamese, Spanish, and Cape Verdean Creole and Haitian Creole. They did not receive that information. So I would say it's definitely structural racism. I believe in science, and so I'm not going to have any conspiracy theories today. But if you can talk about how poverty has created a life expectancy drop in Roxbury of 33 years, that in comparison to our friends in the Back Bay tells you something. It tells you that regardless of my economic status, I have a degree from Wellesley, I feel like I'm a well-educated woman, I am a state representative, and this disease still got to me and my family. And I took every precaution.
Dr. James, you're on the front lines at the Boston Medical Center. You talked earlier about seeing the same people for the same problems over and over again. It seems as if we've been focusing too much in the medical community on the disease rather than solving the overall problem, no?
Right. No, absolutely right. I mean, doctors are taught to focus on disease. That's what they're taught. So they focus on whatever's sitting in front of them. And they're chasing that. But again, patients are chasing life. And the two never align. And what that just leads to is just perpetual poor health outcomes. And by the way, high cost. I will say that hospitals have begun to try to think outside the box a little bit to disrupt some paradigms. Particularly when, people are saying things like, some people have said stuff like stay in your lane or whatever. But hospitals, for example, three hospitals in the city leveraged a policy around the termination of need policy that says when you do construction on your facility, that you have to give 5% of the total cost to the community. And when we did a campus redesign, we asked if we could commit our obligation to different types of housing initiatives, and the state approved it. And what that did was also pave the way for other healthcare systems in the city to do that. And together we invested in housing, unstable housing. We created an innovative stable housing initiative. We were also able to invest in a housing unit over. It's called Bartlett Place. And the reason I'm bringing it up is because that obligation, translated to 321 units of new mixed income housing, some to own, as a matter of fact, and some to rent. 70% of the construction workers there coming from the community, which was optically a beautiful thing to see at the ribbon cutting. And also getting a grocery store to come there and subsidize the units above it and hire people. So we've tried to step outside the box in that way. And also working with at least one organization we know that works with people who live in public housing to break that cycle, that perpetual multi-generational cycle of public housing where people wind up being trapped, because of, this cliff effect. And this organization we work with actually will, if the housing authorities agree, they will work with residents, and they are able to not turn down jobs, which people do, and not turn down raises, which people do, because they don't want to lose their housing. They can actually earn more, and that extra money actually goes into escrow for home ownership. And also it goes into escrow for education for your kids, because everyone in your house is eligible for it. And so, we're not just standing idly, just watching, standing by watching these things happen, because it's like, it's impossible. You can't accept it, as a healthcare provider to watch this. You wonder what you're doing, when you see these things happening over and over again.
And doctor, if I can get you to address this question quickly from Facebook, asking about the impact of chronic stress of living in a racist society.
Yeah, I don't know anybody who's affected by that, including myself. So we actually, I tell you something, the patients will tell us that all the time. If you engage with them and talk to them, and we've studied them on various different things, and what they would say are things like, you know what, I would love to learn more about this or that if I could just address the stress. And I would say that stress and social isolation and those types of things, that is probably the number one thing on the list for people who come in our hospital, because they're so worried about so many things, and which is another reason
Adrian,
why.
Yes.
Are you hearing that as well?
Oh yeah, absolutely. I mean, all of these things are drivers of poor health. I mean, I don't think there's any secret to that.
Yeah. Absolutely. I also want to add to that. Because I think this is also an opportunity for people to understand that this particular issue is something that impacts Black folk regardless of who you are, or what your job is, how much you earn, how many degrees you have. Being Black in America is stressful. So what does that mean? It means, getting up in the morning, going to work. Very few of us go into workplaces where we could just show up and bring our full selves. Most of us wake up, we go into workplaces where we have to prepare ourselves to engage in environments that are predominantly white in culture, and expect us to conform to that culture. It's a constant, every minute, every hour, thinking about how you're moving, how you respond to an email, how you show up to a meeting. All of that that's weight. That's weight that, quite frankly, many of our white colleagues do not have. And it's something that impacts many of us. It impacts parents. I was the chief equity officer for the Boston Public Schools for 2 years. And we would consistently hear from parents, Black parents, about how they had to really think about how they showed up in school buildings so that school leaders would not perceive them as a threat. That lends itself to significant stress. And as Dr. James noted, that, of course, is a through line to, disparate impact on health outcomes. But none of us are immune to that.
Well, our conversation has really been focused on what's going on in Boston locally, but let's zoom out a bit to take a look at the national picture, at least according to the CDC and the latest data from the CDC. Black African American people make up 19.9% of known COVID-19 cases in the U.S. Black African American people make up 23.3% of known COVID-19 deaths in the U.S. And of course, the stark reality is that Black African Americans make up only 13.4% of the U.S. population. Now, we interviewed Dr. Leandris LeBurge. She's the Associate Director of Minority Health and Health Equity at the CDC. She's also a medical anthropologist, and her really sole job is examining health equity and health equity issues in this country. She interprets the data from a humanistic point of view and says one of the things that she worries about is the stigma of being a COVID victim and a person of color. Take a listen.
Our society values people who are young, who are healthy, who are fit, who are fast. And so when we have a condition or multiple chronic conditions that would present us as not being part of the desired group, I think then that helps to add toward a code of silence, if you will. And so the way we handle conditions like COVID-19, I think particularly from a public health standpoint, is going to be very important, so that people, if they happen to test positive for no reason of their own, it wasn't like they went out and did something and contracted COVID-19, other than what we've, not following the mitigation strategies that we talk about all the time. But we want them to be able to say, yeah, I had that. This is what it was like. This is how you can protect yourself, and that it not be something to be ashamed of. I think it's the shaming and the victimization that comes with certain conditions, and that could happen if we're not careful with COVID-19. Well, we work closely with the White House, with the Department of Health and Human Services, and I think we all share a commitment for improving the population health outcomes of our nation.
Adrian, I was having a conversation with someone I know about this issue of the stigma. They are recovering from COVID-19, and in addition to putting up with, all the lingering effects of it, they also are nervous about telling anyone that they had COVID-19 because they do feel this stigma. What are your thoughts on that? Is this sort of general fear right now, or is this a real issue and potentially more devastating for Black and Brown communities?
I think it is a real issue, and I think people do worry about the stigma. But before we get to that, I want to say something about the CDC and the White House and the federal government's response to COVID, which I think has been bluntly, thoroughly racist. I don't think there's any evidence that President Trump has shown any concern about how this affects communities of color. So, having gotten that off of my chest, yes, I do think there is
Right.
stigma and people worry about it, but I have a greater concern than that, and that's with the federal government and its response as it concerns COVID and communities of color.
And anyone else want the reaction to the comments from the CDC?
I agree with Adrian. I do think there is a I trust that the folks at the CDC, are following the science. That being said, we have to be very honest about the fact that we have not, as a nation, handled this crisis well at all, with no national mitigation strategy. And in fact, some might argue policies that, to Adrian's point, were meant to target Black and Brown communities in a way to make us less safe. And what I mean by that is, we're seeing it play out now in Atlanta, Georgia, with Mayor Bottoms being challenged by Governor Kemp on her masking policy, on her masking recommendations. We know that masking and face coverings save lives. And we know that, the data is very clear that while COVID-19 does not discriminate as a disease, it does have an adverse impact on the Black community. So when there are strategies that are put in place that we know work, that the science and the medicine say work, to have the administration really reject those practices is problematic, and it certainly does not demonstrate leadership that is mindful of all of us here in the Commonwealth, let alone Black folk.
We got an earlier question from Kevin in Boston, and this is an issue that's getting a whole lot of attention now as there's this conversation of what do we do about school in the fall, right? We have, there's the issue of the mask, and there's the conversations about, should it be 3 feet distance, 6 feet going on about, within a school, and there are those who, parents who are saying, I'm not going to send my kid back to school. And this presents a whole host of issues for those in Black and Brown communities as well. But this question from Kevin, because of the challenges of delivering remote education equitably, I believe that COVID could be the biggest driver of educational inequality since the property tax. What can be done now about school opening in September to minimize this inequity? That's a tough question. Who wants to take that?
I'm counting to 10 because, as Adrian knows, this is the issue that gets me going right now, because I think it's the one that we're not paying the attention to that it deserves. And at the end of the day, we have to be honest that it is children who are being impacted, and that might have something to do with why this issue is not getting the attention it deserves. regardless of what happened in the fall of 2020 with respect to buildings opening or not, we must fundamentally change how public education is delivered in the Commonwealth. We know that here in the Commonwealth, the data has been very clear that public schools in the Commonwealth are typically in the top 3 in comparison to other states. But when we talk about public education for Black and brown children in Massachusetts, it's shameful what the outcomes are. And that was pre-COVID. Now we have COVID-19. A pandemic that has caused children to be at home, distance learning, some children with no Wi-Fi, children with no computers, children who have gone from maybe 4 or 5 hours of structured learning down to 2, 3 if they're lucky. That's a problem. And we are going to be held accountable, responsible for the adverse impact that this virus is going to have on our children's education if we don't do something different. We must. It is an imperative that we demand that public education looks different in response to this COVID-19 pandemic. This is truly a racial justice issue.
It's an enormous
so
issue.
much.
This is something that keeps me up at night. I mean, inequality in education was a huge issue already. We did a huge project last year, tracking valedictorians from different schools that became the study of inequality. We've got a team that works on this now full time. And what's happened in COVID is going to exacerbate every problem schools already had. And there are no plans that I can see, let alone viable plans, for addressing any of this. They're barely talking about it. And, it's late July. So this is a huge, huge concern.
So putting that aside and knowing that that's still a big issue and the clock is ticking as we get closer to schools reopening, there's this question from Watertown, Michael in Watertown, who's asking, I guess he's looking for a little bit of good news here. What can you point to into a particular community, city in the state that has done a good job dealing with COVID, especially regarding Black and brown residents? So there's a moment for any of you to speak up. Who's doing something right in Massachusetts?
So what I'll say on that is I think what we've seen, what I've seen from my vantage point is that the COVID-19 pandemic has absolutely mobilized the Black community in particular to try to take as much responsibility as we can for our own survival through this. And that's a bright spot. It has brought community together. It has brought community together in a way when, there was no PPE available in communities of color. Folks kind of put their nickels and dimes together to try to make sure that we had masks and face coverings in our community. As we have been, moving through this pandemic, it has been people in the Black community and the Latinx community demanding that there be testing readily available in our neighborhoods, readily accessible in our neighborhoods. It has been really Black and brown community standing up for ourselves, and in this moment, really demanding that we receive the supports that are needed to make it through this pandemic. That's a bright spot.
Dr. James, any bright spots?
I would say for healthcare, I think that in addition to everything that happened at the same time, I think it's given us more insight, or healthcare systems more insight into how something like COVID, could happen and how it could have the kind of impact people are actually doing, or how, the type of outcomes it had. But people are actually doing work inside of hospitals now, having conversations, creating plans and things like that to really address the root causes of it. I think that it was a great exercise, for lack of a better way of describing it, to be prepared for the next time or for the future, or, should something else come up. But not just addressing what will happen, but prevention wise from that perspective. So I think it's been great for us all, and from that perspective.
I want to keep the focus on solutions. Another audience member, Ruth from Cambridge, asking, how can we move forward on essential issues and not get sidetracked with tearing down every statue and renaming every building or street? Some are obvious, but our energy is best spent on moving forward rather than looking back and fighting too many made-for-TV battles. Wow. Adrian, this sounds like you're up your alley here.
Well, I don't necessarily think that these are all made for TV battles, for that matter. But I do think Ruth has a point, though, that this is a moment where we really need to think about what the most urgent battles are, you know. And we're here talking about race and COVID-19, and I think it has put a focus on so many issues of inequality. And this is a time to really keep that conversation going until we reach the point of really thinking through what we're going to do about housing discrimination, employment discrimination, all the other economic and socioeconomic factors that are leading to this tragedy.
Another question from Ron. Go ahead.
Yes. I think we have to be really clear about what we mean by moving forward. And from my perspective, moving forward is about, yes, it's the conversations, but it's also the action. We have to understand that there has been a lot of work. Racism just didn't show up in May of 2020 or in March of 2020. It's been here. And there are those among us who have been working tirelessly to change policy, to bring about legislation, to help disrupt systemic and structural racism. So moving forward must include both individual action to dismantle structural racism and collective action through policies and legislation and programs. So I'm hopeful that, Ruth and others are thinking about what they can do in this moment to help us move forward in a way that is intentional about dismantling structural racism.
And isn't it this time around? I know this has been a battle that's been fought for a long time, with small itsy bitty steps forward and then many steps backward. But does it feel different this time? Doesn't it feel like at the crossroads of COVID and Black Lives Matter, that this feels like it's not going to slide back the way it has in the past?
Yes, but I think we need to slow down on congratulating ourselves on how much better we're doing now and all the momentum now. This is a long fight, okay? It's not a 2-week fight. It's not a 2-month fight. And yes, we are in a very interesting and exciting moment. But, it's going to take a lot of intention and a lot of determination and a lot of sustained focus to make what we should out of this.
Yeah. I mean, look, we had, 6 weeks ago, we had people across the Commonwealth engaged in protesting and demonstration, just mortified to come to understand that through the killing of George Floyd, coming to understand what racism is all about, what the experiences of Black community is all about. And and folks took to the streets. We stood shoulder to shoulder, said Black Lives Matter. And in those moments, I'll tell you, I was very hopeful last month because I did see and feel something different. Today, in July 2020, I'm very concerned. I'm concerned because this is the tough moment. We see today at the State House the debate, not just the debate, the fight that is going on at the State House around policing reform. Yet 4 weeks ago, everybody was on board to fundamentally rethink how policing is practiced. Today, we are receiving so much backlash and so much pushback because today it's about making a decision. Yesterday, it was about saying something. And so I'm hopeful, yes, but I am reserving really judgment until we actually get something done. We have to do things differently this time. And while I'm willing to, and I know so many others are willing to be on a journey, we need concrete signs, that concrete, decisions being made, actions being taken to let us know that this time it really is different.
Dr. James, one of the conversations that I've heard from the medical community is bringing more people of color onto hospital boards and bringing in sort of community voices to help guide some of these potential changes that could happen within the medical community. Is that something that you're seeing and something that you support?
Yes, and we've been talking about that. We've been talking about that for years, to tell you the truth, because people don't know what they don't know, and you can't know what you don't know unless you have other voices at the table, to inform you. And so it's even having more doctors of color. I mean, I can remember even like being an intern and hearing the next room over, the interview being had with the patient, and I'm thinking in my head, the patient doesn't know what you're talking about, and they're not going to do that thing because I just know. I know them, right? And so it requires, more diverse minds at the table. I mean, I'm cautiously hopeful. People have short memories, and I think if we don't seize the moment and just like keep things going, keep the momentum going. And I agree with Tanisha. It's about action. It's about action. It's about getting things done. If we don't do that, I worry about what will happen or not.
I want to take one more question from.
We got to stay in the street, and I think that's really important. When you talk about what's changed from like a month ago to now, we got to keep the protests going. People have to stay in the street, otherwise it all goes back.
Okay, very good point. I want to take one final question from an audience member, and maybe all of you can jump in on this one. Ron from Saugus is saying, in the spirit and honor of C.T. Vivian and John Lewis, what lessons can we learn from them that can be applied to the current pandemic that we call COVID-19 and the pandemic of racial inequality?
Both of them were Reverend Dr. C.T. Vivian and Congressman Lewis were both deeply committed to community. And their work was rooted in community. It was selfless work. But there are three things that immediately come to mind when I think about the two of those giants who we lost. One is that they saw this issue of racial justice as one that is truly about humanity. This is a humanitarian fight. This is a humanitarian mission. And both of them had at the core of their work a deep love for humanity. Both of them absolutely led with courage. They demonstrated courageous leadership. And certainly during this time, we're seeing the importance, the need to have courageous leadership. This is not easy work. And then finally, both of them had tremendous humility. We are all on a learning journey. Dr. James said it. None of us knows it all, even those of us who were born in this skin and who have been in this fight for decades. None of us knows it all. And so the humility that they both displayed in their work, I think is certainly something that we can all learn from and hopefully model.
And quickly, Dr. James, some final words?
I would say persistence, and for certain humanity, as Tanisha said, and fearlessness. Just not stopping and not letting anything get in your way.
Adrian, final words from you.
When I asked John Lewis about getting arrested 40 times in the 60s, he said, "I've been arrested 5 times since I've been a member of Congress." And his point was, the fight never ends, the struggle never ends, and you have to be committed all the way through. And he was to his last breath.
All great comments. Finally, we want to hear once more from State Representative Miranda, who has a message of hope.
I think we have to remain hopeful, and we're a resilient, righteous people. We don't get knocked down easily. And I've seen countless community members come to the rescue of their neighbors. Folks like Rep. John Santiago, who's working in hospitals at Boston Medical Center and also in the State House, doing the dual duty of being a legislator and a doctor. We have folks who are really championing testing sites and mobile testing in our community. We've come a long way in 3 months, and Massachusetts, I think, was right to slow down the spread by not opening up quick enough. And now as we're thinking about going into phase 3 and 4, I urge caution, because the communities that are going to be impacted are us. But I just say to folks that I'm with you, that I survived, that there are people every day walking out of hospitals better, and we can use that as energy for the fight ahead. And I just want to encourage folks as well, you know, as we look at race, we cannot ignore race in anything that we're sort of working toward now, especially COVID. I know the picture sounded grim. That is our reality, but also our reality is that we have fought many things in our 400 plus year history on this land and in this country, and we'll continue to fight together.
A good note to end on. I want to thank our panelist, Dr. James. Thank you so much for all of your insights. Adrian, thank you as well for all of your comments as part of this conversation this evening. And Tanisha, of course, a lot of great examples and great points made during this conversation. I also want to thank our partners, the NAACP Boston branch, the Boston Globe, and World Channel. All have contributed to the ground we have covered here this evening. And a special thanks to the Globe for their wonderful historic photos that we used in the open to our show. And to Berkeley student Ali E for her song, you heard it, Welcome to America. That was at the beginning, the intro to our show this evening. Most importantly, thank you, all of you who are watching and will be watching this show. Thank you for all the great questions that came via Facebook and those that came in advance as well. Keep an eye out for more episodes of The State of Race coming in the fall. And before then, July 31st, another opportunity, a week from this Friday. Basic Black is coming back with a special show focused on generational activism. Again, thanks so much for joining us this evening. I'm Dan Lothian. Good night.